No, you should not enter the kitchen during periods. Don't eat curd, pickles and tamarind. It can disturb the menstrual flow. Now these are some of the myths regarding health that we have often heard. And as common as these sound, we need to understand the impact such pieces of disinformation can have on the public, especially women in rural areas with limited healthcare resources. In this video, let's try to understand how such health-based disinformation is spread in rural areas and the role of internet and technology in this. And what is the importance of gender here? Come, let's find out. Do you know that by 2025, around 56% of the total new internet users will be from rural India? A recent study shows that of the total 759 million, nearly 399 million users are from rural India. So naturally, the rural population is exposed to all kinds of information online. And among the social media platforms used, YouTube and WhatsApp are the most preferred platforms in rural India. This is evident from a report released by Bharat Labs, which says that 50% of the youth in villages consume YouTube regularly for entertainment over and above all other platforms. And did you know that India is WhatsApp's biggest market in the world? It has more than 200 million users in India. With its wide reach, these platforms are also a hub for false data, miracle cures, and conspiracy theories. According to a study published in a journal named MDPI, 67.2% of fake news is related to health. And with the lack of awareness, this becomes more dangerous in rural India. A prime example was during the pandemic when there was an extreme COVID-19 vaccine hesitancy in rural India. The false beliefs were that COVID-19 does not exist and people who get vaccinated against it die. This way, when false information or misinformation reaches a point of causing harm to society and people, it becomes disinformation. And this disinformation increased in rural areas due to the easy access to online content, with a thin line between false and verified information, especially on smartphones. It gets more complicated when it comes to women in rural areas, as some social evils and taboos are still prevalent. Women in rural areas also faces challenges like poor healthcare access. This includes little access to natal, postnatal and reproductive care, or expectant mothers receiving maternal education or training. In India, discussing women's sexual and reproductive health is still taboo, especially in rural areas. Dr. Jodi, head of gynecology at RDT Batlapalli Hospital, talked about how women are taught and expected to suffer in silence. Hence, issues related to their health are always neglected and never spoken about. In rural India, it is worse than the cities, she says. A prime example of this was during the pandemic when COVID-19 vaccines were said to cause infertility and disturb the menstrual cycle. In rural India, due to cultural and religious beliefs, menstruation is perceived as dirty, impure and even unholy. Periods-related misinformation and stigma should never stop women and girls from accessing life-saving services like free vaccination and healthcare. To deal with health-related disinformation, it is first necessary to teach people in rural areas to identify them. They should be told how harmful it can be to spread any kind of information without checking it, especially when it comes to health. A few simple steps to combat this are: A. Read the story, not just the headline. B. Verify the story through credible sources. C. Ask yourself about the purpose of the content. Outlets like Alt News, Boom Live, AFP Fact Check, Factly and PIB Fact Check put out regular updates and bust fake news. This will be very helpful. Social media platforms, especially those like WhatsApp, which have a greater reach in rural areas, need to implement more policies to control disinformation. This is because people's access to the internet and information in rural areas is increasing rapidly, but unfortunately their access to health facilities is still very limited. Comment down below the health-based disinformation that you have come across and tell us where. Thank you for watching this video. Want to know how we can identify and address this gender-based disinformation? Stay tuned for the next video where we discuss the same. Till then, watch the previous videos in our series where we get into detail on gender-based disinformation and how it affects our society at large. This is a video series developed under FactShala Innovation Lab, a media literacy incubation program by FactShala where we talk about gender-based disinformation. We have more important topics coming up, so stay tuned. Like and share this video. Also, don't forget to subscribe to our YouTube channel. See you in the next video.